Hello, Lincoln. My name is Larry Williams, and this is Health Matters. Today, I'm very, very happy to have with me three women who are going to talk about the Breast Cancer Coalition in Lincoln. And I think it's very important for everyone to pay attention today because breast cancer is an issue in our community. Welcome, ladies. I greatly appreciate you all being here today. I'm going to take time here and ask you to introduce yourselves to our listening audience. We'll start with Regina.
Okay, I'm Regina Sullivan. I'm the Health Outreach Specialist for the Malone Community Center, and I am an advocate for breast cancer.
How long have you had that position at the Malone Community Center?
It'll be coming on 4 years in April.
Maybe just briefly, can you kind of describe some of the things that you do as a health outreach worker?
I am responsible for hosting events in the community to try to find people that don't have a medical or dental home and try to get them established into one. This is for low income or no income individuals.
Okay. I think most of the audience knows that I'm the executive director at the Malone Center, so we work very closely together when it comes to health outreach in our community.
Definitely.
Thank you, Regina. Reverend Janet Banks, well, maybe you can tell us a little bit about yourself.
My name is Reverend Pastor Janet Goodman Banks. I am a volunteer with the Breast Cancer Coalition. I'm also a breast cancer survivor of 4.5 years.
Okay. Thank you very much. Thanks for taking time out of your schedule to be with us.
You're welcome.
Renee, Massie, maybe you can talk a little bit about yourself and why you're here today.
I am Renee Massie, and I am a community volunteer with the Breast Cancer Coalition. And I also work with the Lincoln-Lancaster County Health Department as a public health educator.
Again, ladies, and thank you all for being here today. Regina, let's start off. Tell us a little bit about the Breast Cancer Coalition. My understanding you're a subcommittee of Lincoln Cancer Coalition, Breast Cancer Coalition, but maybe you can talk about who you are, what you do, and what some of the goals are of this Breast Cancer Coalition.
Sure. We are a group of African American women who live in this community. There's about 7 or 8 of us, and we have a passion for educating our community on cancer. Excuse me. Our goals are to educate women on the importance of early detection, raise awareness in the African American community, and provide education about resources to the community, advocating for screening guidelines that are responsive to the needs of Black women, promoting routine self-breast exams and clinical breast exams, and we're here for overall support.
Okay. Maybe you can tell us a little bit, how often does this subcommittee meet? And what is a typical meeting like for this Breast Cancer Coalition?
We meet once a month, and we get together and we talk about how we can raise awareness about getting women mammograms for low-income people that don't have, enough to to afford a mammogram.
Mm-hmm.
So, and we're here to provide support for those people that are living with cancer and that, have no idea how to go about getting themselves well.
Okay. All right. Thanks very much.
You're welcome.
Renee, one of the things I always hear is that, we've got this group for African American women, we've got this group for Latino women, or Latino men, or Latino women and Latino men, or we have a group for Native Americans or Indians. I mean, why is it important that we would have a group of African American women involved with breast cancer outreach?
Larry, there is a common goal for all women to get screened and to receive treatment in a timely manner. But the way health and wellness messages are presented to different groups of people, it's very important. And so a more culturally specific message can be crafted for different ethnic groups. So there's no one size fits all message for all groups. And so if we have a African American subcommittee group, that's because African American women, certain messages on health and wellness issues are tailored for African American women. Say if we have a Hispanic subcommittee group, there's a health and wellness message with the same common goal, but it's tailored for that culture of women. And so not every message resonates the same with every culture.
Sure.
So you want the same outcome, you want the same common goal, but your messaging has to be different. It has to fit that culture
Okay.
of people. So we're not dividing the women because we have the same common goal, but we want to make sure the same message resonates with each culture.
Okay. Different cultures will hear different things, and we want to make sure that all the information is provided for our different cultural and ethnic groups throughout our community. And whatever we can do to prevent breast cancer, we need to do.
We need to do it.
We need to do. Anything else you ladies would like to add to what Renee said there? Okay, Reverend Banks, what are some of the signs of breast cancer? As a breast cancer survivor, I think, you have, what can I say, not unique insight, but I mean, you just know.
Sure. Some of the questions, or a question that a person may have is, I'm worried I might have breast cancer. What are the signs? And often there are no outward signs of breast cancer that you can see or feel. If there are outward signs, the more common ones include a lump, an area of thickening, or a dimple in the breast. Less common signs include breast swelling and redness of an enlarged underarm lymph node. But even if you have one or more of these signs, it still does not mean you have breast cancer. Remember, most breast lumps turn out to be benign or not cancerous. Some signs of breast cancers are lumps, nipple changes, cysts, and breast pain.
Okay, all right. Regina, what are some factors that contribute to the difference in survival rates for women of color, African American women, or white women? Maybe you can kind of talk about some of that information.
Sure. Breast cancer is the second most common cause of cancer death among African American women. Black women are less likely to get treated, but have a higher mortality rate than white women due to not getting screened, not getting treated in time, and their lack of knowledge of the resources that are available. Black women are being diagnosed at an earlier age than white women with more advanced stages of cancer without any symptoms. Some studies have shown that black women are not given the prompt, high-quality treatment as white women as well.
Okay. Anybody would like to add anything to that question at all about some of the survival rate differences at all between people of color, women of color, and white women when it comes to breast cancer?
I think that a lot of women of color focus on their families and their roles in the family and how they're needed, and they're the last ones to take care of themselves.
Okay.
So they wait longer, and sometimes it's too late. So that affects the outcome. As far as the medical field, I am also a nurse.
Correct.
And sometimes, in my experience, I have seen some differences in care as far as one community versus another. And we hope to encourage and empower women of color to speak up and speak out concerning their health, and in educating them in doing so.
Okay. Reverend Banks, again, you are an registered nurse, in addition to a community activist and survivor in the breast cancer area. What are some of the risk factors of breast cancer?
Some of the risk factors of breast cancer are weight, diet, exercise, alcohol consumption, smoking, exposure to estrogen, recent oral contraceptive use, and stress and anxiety.
Okay. And in that list that the items that you listed there, I guess what you're saying is that smoking seems to, women who smoke, greater incident of breast cancer.
Yes, they have a higher rate of contracting or having breast cancer. Yes.
Okay. And what were some of those? Could you go over that list just one more time,
Sure.
please?
Weight.
Okay. Let me ask you there. The heavier you are, if you have more weight, more likely, is that what I hear you say?
Yes. The denser the tissue,
Okay.
your tissue. And so that's why we encourage exercise and eating healthy, because if you are overweight, that is a risk factor.
Okay. Go over that. If you could continue on with that list there. If you
Sure. Diet, exercise, contraceptives, alcohol consumption, smoking.
Okay.
Smoking also increases your risk. Everything that I've listed increases your risk of contracting breast cancer.
Okay. All righty. Anything else the other ladies would like to contribute to those risk factors that
And
Reverend
not
Goodman?
getting a timely diagnosis, not getting treated in time.
Okay.
And I also wanted to stay with the stress and the anxiety. You know, some people look at that as, oh, that couldn't be a cause or a factor, but it really can. And we all need to, we all cannot, go away, get away from stress or anxiety. It's part of life, but we can try to control it. And so by doing some of these things like exercising, maybe delegating some tasks, maybe taking walks, getting involved in church or other activities that make you happy. So.
Okay. Okay. Well, it seems the one way that we are able to determine if a woman has breast cancer is through a mammogram. We're going to take a quick break here, and then we're going to come back and talk about mammograms and what they are, what happens, and why women should be making sure that they have a mammogram. Okay? Lincoln will be right back after these messages, and we'll continue our discussion with members of the Lincoln Breast Cancer Coalition. Thank you.
Hello, I'm Gabrielle Union. By working with Susan G. Komen for the Cure, I've learned a lot about breast cancer and how it affects African Americans. We die of breast cancer more than any racial or ethnic group. Our 5-year survival rate is 77%, compared to 90% for white women. There's evidence that the types of breast cancers we get are more aggressive and at the same time less responsive to available treatments. Visit circleofpromise.org to learn more.
Welcome back to Health Matters with Larry Williams. We're going to continue our discussion on breast cancer awareness here in Lincoln, Nebraska with our Breast Cancer Coalition members. We have today with us Regina Sullivan, who's at the Malone Community Center as an outreach specialist, Reverend Janet Goodman Banks, who is a community volunteer and a breast cancer survivor, and Renee Massie, who is another community activist, part of the coalition, and does work with the Lincoln-Lancaster County Health Department. Again, I want to thank you women for being with me today to talk about this important issue. Reverend Banks has a registered nurse and also a breast cancer survivor. Why don't you talk a little bit about what is a mammogram? What can a woman expect when getting a mammogram?
Okay, I'm a licensed practical nurse, and when you have a mammogram is just an x-ray. It examines the breast that's used to detect and evaluate breast changes. So mammograms today expose the breast to much less radiation as it did in the past. So it's a simple procedure. May pinch just a little bit, but it's a very, very important, what I would say in simple terms, an x-ray that can help detect breast cancer in a woman.
Okay. Why do women not get mammograms in a timely manner? What's going on there?
You know, here in Lancaster County, we don't know that for sure, but that's one of the things that our coalition wants to explore more. Yes. We don't know if it's fear. We don't know if it's affordability, no health insurance. We don't know if it's because of stories that women have heard from other women, and some women themselves have had a mother and an aunt, a cousin that have experienced breast cancer before, and then they've seen firsthand some things that have caused them to be very fearful.
Yes.
And so those are some of the reasons, and we just can't pinpoint no one particular reason. And so one of the reasons our coalition have come together so we can explore some of those things and some of those reasons in Lancaster County. But one good thing that we have came across, and we don't know how new this is, but it's new to us, and we plan on presenting it to the African American women in our community, but not limited, and we want to say it's not limited to
Correct.
African American women.
Right.
You know, we definitely want to say that. But we did find out that with advanced medical imaging, they offer what they call a mammo party, which is a mammogram party. And you can bring 6 or more women together, and they do it after hours, between the hours of 5:30 and 8 o'clock, I believe it is. And what they offer that evening for the women, they offer appetizers that evening. They offer neck massages. It's just like a little lightweight get-together, a party, but you're there for the very important screening, the very important mammogram. But the women are not alone. You're not left there alone. You have someone there to go through the process with you, because those 6 women, you can invite a family member that has not had had a mammogram. It could be a friend, it could be an aunt, it could be your mother, it could be whoever out of that group of 6. And so what we're in the process of doing is trying to bring women of 6 together and get those mammogram parties set up.
Okay.
So
All right.
Yeah.
So it's kind of like a girls' night out.
it's a girls'
It's a
night
girls'
out.
night out.
Is that
It's
what
a
you call
girls-
it at
it's
your
a-
meeting? Girls' night out.
It's a girls'
Yes.
night out.
Okay.
To take the fear out of having a mammogram, because it really isn't a bad procedure, and it's one that can save your life. It saved my life. That's how it was detected in me through a mammogram. So we just want to encourage women of color, and as Renee stated, it's not limited to women of color, but as African American women, we do want to focus on the women in our community.
Yes.
Okay.
And one of the tools that we developed for this particular project, and not only this project, but for women to be able to contact us with any questions, we developed a bookmark with I think all 6 or 7 women, our name on the bookmark and just our telephone number, and they can call us and they can let us know if they're in need of a mammogram, or if they need information on where to go to seek information or to seek treatment, or any of that information. And so we did produce a very simple bookmark that we could hand out to women in the community. We run into the grocery store or church or the gym or wherever.
Okay. And that bookmark is now on screen for women who are interested in Girls' Night Out or any of the
Yes.
other programs or outreach things
Yes.
that you're doing.
Yes.
They can call members of the coalition and discuss what could be done with their particular club,
Yes.
their sorority,
Yes.
their
Yes.
faith group,
Yes.
or whatever,
Yes.
wherever
Yeah.
women are gathered,
Yes.
they can call you and you can give them information
Yes.
about what you're
Yes.
doing with the coalition and breast cancer awareness. Okay?
Yes.
And again, that bookmark is now on screen, so those folks, if you're interested and you need information, please give the coalition members a call. Anything else any of you ladies would like to add about that? That was a good discussion about those particular activities that you're engaged in.
We just really want people in the community to feel comfortable about having this procedure done, and empowering them and encouraging them, as well as educating them that they're not alone, what this is about, and that there are avenues out here. There is help out here, and there are people out here to support them in their journey.
Okay. Okay, thank you. Renee, how do we start educating our young women to be interested in breast health?
I'm glad you asked that question, Larry, because we do need to start the conversation with our younger women. And we believe that high school is not too young to start that conversation with the younger women. And one of the things that we can do is for them to begin to start the conversation, or for us to begin to start the conversation with the younger women, is to host some basic conversations in some community centers, or some clubs in school as well as out of school, some church groups or youth groups, and just have some basic conversations and bring in some knowledgeable facilitators to facilitate some conversations. And one of the things that young women could start to do, that it's not too late to do, is start initiating a conversation with family, finding out about family history, you know, what has gone on with the family in the health arena, as far as breast health, and not only breast health, don't stop there, but health related issues, period. But because we're talking about breast health, but start with breast health. And another thing that could happen is mother-daughters could form some type of girls' night out together and visit mammogram clinics and those type of activities. Some high school girls have no knowledge of what mammogram machines look like or what a mammogram is. Some mothers don't know. That's something that they could pair up and do together. Instead of shopping sometimes, something like that. They could pair up and do things like that. But it's not too early to start that conversation with high school girls, college girls, 20-year-olds. I think that we need to start initiating the conversation with our high school young women.
You need to be responsible for your health.
Yes.
Anything else you ladies would like to add, Reverend Banks or Regina, about that?
I just concur with everything that Renee stated. I believe that once you find a family member that has been diagnosed with breast cancer, you want to subtract 10 years from when they were diagnosed and look at that and see when you or someone else in your family should be diagnosed, minus that 10 years when your family member was diagnosed. So say if someone was diagnosed at 42, then at age 32, you know, you may start looking at wanting to be screened.
Okay. We have about 4 minutes left, and we've got two questions that I definitely want to get to before we run out of time. And this is from my perspective. You know, as a man, you know, what can I do, or what should I be doing, Reverend Banks, when it comes to working with women, when it comes to breast cancer? What should men be doing, or if anything at all?
I would say, first of all, listen. Listen to women when they say that they feel a change in their bodies or if they've been diagnosed with cancer. After that, then there's just the common courtesy things. Help around the home, help with the children, help your spouse or your the person you're in a relationship with get to appointments. Educate yourself along with your companion or spouse about what's going on with them. Those things help immensely with a woman's recovery and getting well.
In addition to as a husband, or as a brother, or as an uncle, or as a grandfather, whatever it is, encourage your loved ones, the women in your life, to get a mammogram.
Yes.
To take control of your health and to be in control of your health by being in that preventative mode.
In the preventative mode.
Okay. I think that's real important, and I hope that the men in the audience today that might be tuning in will really encourage women to get their mammograms. Regina, who do we need to contact, or how can we contact folks of the Breast Cancer Coalition, that subcommittee of the Lincoln Cancer Coalition?
Well, you can contact any one of us lovely ladies,
Okay.
and we can, like you say, we'll put up the bookmark with our phone numbers and our names on it, and we're here for support.
Okay, alrighty. Again, that bookmark and those numbers are listed on the screen right now for you to look at. Well, we're about ready to wrap up here. Is there anything else that any of you would like to say before we close out our program today?
I would. We are also, we host an annual Protect Your Health Heritage event every year, and that event is to also raise awareness in the African and American community. We have screenings there, there's some speakers, and sometimes we get doctors and survivors to speak, and I think it's a very important event to have people come to and to raise awareness and to get the information about how you can get help in the community.
Okay, and if someone wants to find out more information about that event, they can go to the Malone Community website or the Lincoln Breast Cancer. Where can they find out more information?
There, or cancer.org, which
Cancer.
is American Cancer Society.
Okay.
And, we partner with them to, and we collaborate with them to pull this event off. So.
Okay, and one more time, what's the name of that event?
Protect Your Health Heritage.
And cancer.org, AmericanCancer.org
Yes.
for more information about that event. Alrighty. Anything else, ladies?
No, I just wanted to add to what Regina said, and we host that event in the evening to
Yes.
try to make that more accessible to folks that work, so they can get there in the evening. And we usually
And there's a meal.
Offer a
there's
great
a
meal.
Okay.
A very nutritious
Yes,
meal
very
Okay.
nutritious.
provided because we host it over the dinner hour.
Sure.
And so there's a meal provided.
Free
and,
screenings.
The screenings are all free. They're very good screenings.
Yes.
And everything's free.
All right.
Everything's free. The cost is free.
Yes.
Thank you so much. I greatly appreciate you taking time out of your busy schedules to be with us today. And again, Lincoln, be sure, protect your own health. Be in a preventative mode. Encourage women in your life to get mammograms. That's it for today, and we will see you next time on Health Matters with Larry Williams. Bye now.